Assalamu alaikum. Today I'm going to tell you all the equipments you need to have to examine your patient in primary care, and I'm going to show it one by one to you so that when you're setting up your primary care clinic, which instruments should you have in your clinic. So let's come to this examination tray. First of all, you need to have a hand sanitizer, right? So it could be of any brand, and then you need to have a pair of gloves. You can either have latex gloves or you could also use plastic gloves. Then you need to have tongue depressors. You need to have these tuning forks, one of 128 and one is of 512. It's used to measure vibration in a neurological examination and also to test for hearing. Then you should have an otoscope with you to examine the ears. I'm going to show you how to use this otoscope. You need to have a peak flow meter, and peak flow meter is used to assess patients for asthma, and it also has prognostic value, which means that once the patient is on medications, you can recheck it and see how much the patient has improved. You need to have a torch to examine the throat and also to examine the eyes or the nose. Then you need to have an infrared thermometer. You could also have a mercury thermometer. How you use it? You just press it on the skin and there you get the value. You need to have a measuring tape if you are measuring for chest expansion, or in an antenatal patient if you need to see the fundal height. You need to have a piece of cotton and a few common pins just to check for a pinprick. You should use the blunt end of the pin and not the sharp end to hurt the patient. You need a hammer for a neurological examination to see the reflexes. You should have a stethoscope. So this is basically an examination tray. Besides that, you should also have you can have a wall-mounted blood pressure apparatus, or you can have a mercury sphygmomanometer. You should have a lamp. For example, if you're examining the patient for vaginal discharge, you're doing a per speculum examination or a proctoscopy, then you need to have a lamp to have a clear view. Also, in a clinic, you should have an illuminator so that when the patient comes to you for an X-ray or the patient comes to you bringing the X-ray film, you're able to look at the film properly.